Assalamu alaikum wa rahmatullahi wa barakatuhu. Welcome to Health Issues, and I'm your host today, Dr. Munir Ravalia. Inshallah, today we want to look at general health concepts in Ramadan and for our fasting. But I would like to raise one proverb, a very old Arab proverb, that states from the doctor to the patient that you, I, and the disease are three things. Hence, if we work together, meaning the doctor and the patient, we will be two against one. And surely the strength of 2 over 1 will defeat the disease, inshallah. Islam gives us the guidance in every aspect of life. As Allah subhanahu wa ta'ala has created us, if we take something very simply, a simple analogy, the body is like a car engine. Hence the manufacturer of the car, they know what is required to make this car function. For example, you need to put in the correct petrol. Is it leaded? Is it unleaded? Is it diesel? In the same way as Allah subhanahu wa ta'ala has created us, He knows what we need, what juice we need, what food we need. And again, also, when we become diseased, when we have ailments, just like when you go to the mechanic and he will diagnose the fault, Allah subhanahu wa ta'ala has created us, and hence He knows how to prevent the defects in us, and for us to visit the relevant health physicians and doctors so that we can overcome these diseases. I would like to also stress that I do practice al-hijama, so during the course of the show, I will be relating to several aspects of this, because the Prophet ﷺ, he advised us that in a hadith that the cure is in three things. One is the honey, one is in the hijama, and one is in cauterization or firebranding, but he forbade us as his followers to use the cauterization. So inshallah, if we look back to these concepts from Islam, from Nabi sallallahu alaihi wasallam, because at the end of the day he was rahmatan lil alameen, and he was a guidance for mankind, and not only a guidance for Muslims, inshallah. Muslims observe fasting in the month of Ramadan, which is different to the fasting of those who may be Christians or Hindus. For example, in the Christian religion, they practice a concept called Lent. So for example, they will choose something like sweets or chocolate, and for a period of time they will abstain from this. But Muslims, we fast from the day, from the sun, as soon as the sun rises, to the sunset, and we call it total fasting. Other concepts of fasting that we see, for example, in the Hindu religion, they may abstain from meat from certain days of the week, but again, as we mentioned, we abstain from food and drink totally. But it is also not this. As we are advised by Allah subhanahu wa ta'ala in the Quran, that He says, "O you who believe, fasting is prescribed to you as it was prescribed to those before you, so that you may have taqwa, have self-restraint." So the fasting is not only from abstaining from the food and drink, but it is also for one to abstain, for example, marital relationships, for those who smoke, to abstain from this. And inshallah, in the month of Ramadan, if anyone is indulging in these activities of smoking, then inshallah we will encourage you to reduce this for your benefit, for your life and your well-being, inshallah. Food is required by the body for energy. And there is different substrates, but I will try and keep the terms very simple so that we can understand them together. For example, if we take glucose, it is a sugar that is required by the body for energy. Any excess sugar, for example, if we're having too many sweets, too much fat, this will be stored by the body, and this is how one becomes fat. And it is deposited in different parts of the body, but we mainly see in male Asians, it's around the circumference of the stomach. It's very hard to get rid of this, which requires not only self-restraint in what one eats and what one drinks, but also requires physical activity. Because unfortunately we see in the Arab world, in the Muslim world today, that we live very sedentary lifestyles. And this causes us very great health problems that are being conducted in the West. For example, in 1975, a gentleman called Dr. Alan Coate, in his book Fasting as a Way of Life, he notes that fasting brings a wholesome physiological rest for the digestive system and the central nervous system to normalize itself. It must be pointed out, however, that there are also many aspects of total fasting. And this includes if someone has a total fasting for a prolonged period of time, it is not beneficial as well, because the Prophet ﷺ, he was asked once a question about this, that if I fast all day and I pray all night and I keep away from my wife, is this recommended? He said, anyone who follows this is not from me. So everything is in moderation. Everything in life. When we work, we work in moderation. We spend time with our family in moderation. And we eat and we drink in moderation. And Ramadan is a very good time for us to detox our bodies. A very good time for our cells and our body and energy to replenish itself, revitalize itself, so that the following months the body is strong, does not become weakened. And inshallah it will also help us so that we can maybe try and fast outside of the month of Ramadan, on the recommended time when Nabi sallallahu alayhi wasallam used to fast, inshallah. Other great doctors in the West have looked at dietary problems. Again, when I say the West, I'm not only in the West today, but in the Arab world. The rate of obesity is the highest actually in the Arab state of Qatar. Obesity rate has overtaken the West, for example, America. And this is again because of the eating the fast food, junky food, and leading a very, very sedentary lifestyle. Therefore, we need to combat this and look at ways that we can assist each other, and especially teach our young children, because this is where any concepts start from the young, from the child. So it's very important for the parents to give this message, deliver this message to the children and to those in the family. Maybe you are a doctor, a healthcare professional. We need to give this advice to our family, then to our friends, and then to the wider community, so that we can benefit from a healthier lifestyle, which will inshallah enable us to worship our Creator Allah subhanahu wa ta'ala in the recommended way. For example, in the month of Ramadan, in Taraweeh, we need to stay up a little bit later, maybe make the tahajjud, but we need the energy for this. And the time differences in some areas, for example, in the United Kingdom now, the length of the fast will be quite long. It is in the summertime, maybe it will be heat, and we will not be used to this, the body will not be used to this. So therefore we need to take precautions on how we can re-energize ourselves, so that we can carry on our daily lifestyle. Because Ramadan does not mean that we just we fast and we sleep all day, and because we still have to work. We have to go to work, we have to have time with the family, we have to have time to make ibadah, because it's a very important month for us, as everybody knows. So looking at what we eat, what we drink, and how we exercise our bodies. Exercise does not only mean sitting in a gym, running a marathon and things like that. Exercise can be even the physical act of the prayer, the normal 5 daily prayers. There is scientific evidence that it causes an increase in blood flow in the brain when you make sujood onto the floor. This helps the blood flow to the brain, and this helps us to keep vitalized, energized, and give energy to the brain, because this is what we need to think, and what we need to function and concentrate when we are praying, inshallah. The West, some Western dietitians, they are calling fasting cleansing and detoxification. And they're saying it is the missing link in the diets in the West. For example, if we look at some diets, one is called the Atkins diet. And this, you're abstaining from certain food types for prolonged periods of time. But this is not beneficial, because once you stop the diet, then the body, again, it replenishes itself, and this fat and all these molecules can redistribute themselves. Therefore, if we look at the benefits of fasting are, even during outside of the month of Ramadan, fasting, for example, on Monday and Thursday, it is a missing link in our life, because unfortunately, as I mentioned, we eat way too much. However, saying this, there are still people throughout the world that have not enough food, that are starving. Therefore, we need to look at how much we eat, what we need to eat, and maybe look at ways of reducing our consumption, so that we lead healthier, more sustained lifestyles, and Allahu Alim, maybe keep us living longer lifestyles. Hijama, as I mentioned before, is a great detoxification for the body. Now, there is difference of opinion whether one should have hijama done in the month of Ramadan. In a hadith, we see that the Prophet ﷺ, he had the hijama done on himself, but he advised that if it causes weakness to the individual, then they should abstain from this. Because Islam, everything in Islam is a prevention. Medicine, any walk of life that we look at, everything in Islam is to prevent. For example, when people say, oh, Islam, you cut off the hand of the thief. It's not because Allah subhanahu wa ta'ala wants people to walk around without hands. It's because it's a prevention. The same way in health. If we look at prevention, is better than cure. Therefore, if we look at hijama, it is a way of cleansing the body, detoxifying the body. And therefore, if we try and conduct this yearly, maybe even before Ramadan, because if the body is not used to it, it can become a shock for the body and cause weakness. So we want to look at preventing the disease and not causing more harm for the patient. Therefore, if somebody is elderly, somebody is young, somebody has any ailment, diabetes, hypertension, that's high blood pressure, them having the hijama done on themselves can cause weakness for them. And hence, if someone is fasting, you will require energy for the normal fast. But if you have the hijama done, you will require more energy at a specific time. Especially as soon as the hijama is done, due to the physiology of the body needs the energy to make fresh blood. So you will need to drink something, drink some juice, get some glucose or sugar back into the body, inshallah. So I hope that I have just highlighted some various issues today. And again, we look at the old Arab proverb. It's very important for one to work with the physician and the doctor to understand the fasting patient, if they are Muslim or non-Muslim. And inshallah, I'd like to thank you for joining us. Wa jazakallahu khairan. Wassalamu alaikum wa rahmatullahi wa barakatuhu. Assalamu alaikum wa rahmatullahi wa barakatuhu. Welcome to Health Issues. My name is Dr. Munir Ravalia. I'm a practicing dental surgeon. Inshallah, today we would like to look at the health benefits of fasting. What are those actual little tiny reactions that are happening in the body that we see from the fasting that is actually benefiting the body physically and mentally? Fasting, if we look at it very simply, it is a relaxation for the whole body systems. The digestive system that we have is constantly having an influx of food. Maybe we're snacking on chocolates, peanuts, sweets, maybe the whole day. So the body never gets time to rest. For example, a car. Sometimes we need to leave the car for a few days, maybe use a bus, maybe walk. Let everything just lie still and relax. The same way the body requires this from us. So not only the digestive system requires this, but also the liver, where the food is metabolized. All the little tiny reactions and cells require from us that we give it time to replenish and re-heal, because from our diet, depending on what we eat, if we're eating very fatty things, very sugary things, constant amount of sugar and glucose, this will affect our body, and these cells can die and become atrophic, and therefore we need to allow them to rest, and this will inshallah benefit us for the rest of our lives. The Prophet ﷺ, he said, the son of Adam never fills a bowl worse than his belly. And I want to pick up on one issue. As we are in Egypt today, alhamdulillah, when we go to somebody's house, the people are very kind, very nice, very hospitable. And sometimes we go, even after eating no breakfast, we go for lunch there, and the whole table is full of food. Alhamdulillah, it's barakah, and may Allah bless these people, because they're very kind. But just one point I want to make them. There comes a time when you have to say enough is enough. For example, Nabi sallallahu alaihi wasallam, he said a third for food, a third for water, and a third for air. Therefore, if there is 20 dishes in front of you, it's physically impossible to finish all of these. So I would just like to give some advice to my brothers, that jazakallahu khairan for giving us so much food, but we only have a limited size of our stomachs. So inshallah, bear with us. It's not that we are being rude to you, but we want to try and inshallah follow this hadith. And maybe you can utilize this in your practice when you're being hospitable and hosting people. Alhamdulillah, give them the food, give them the drink, but maybe try and recognize this hadith so we can take this to benefit ourselves in our deen, in our religion, and inshallah benefit us in our dunya. Now we are going to look at something further. What should we eat? As I mentioned, 1/3 of food, 1/3 for water, and 1/3 for air. It's very good before one is fasting in the breakfast time, to look at certain foods and certain things we should eat. Again, the Prophet ﷺ, he advised us that indeed in the suhoor, this is a blessing. So we need to look at which foods will sustain us for a long period of time, especially in the areas where fasts will be maybe 12, 13, 14 hours, quite prolonged periods of time. Therefore, we need to eat things that will maintain our blood sugar level so that we have energy to conduct our daily lives, going to work, being with our family, and obviously after the breaking the fast, to conduct our night prayers and gain the full benefit from this blessed month. Hunger is a thing that I don't think many of us experienced. But if we look at one of the benefits of fasting, it is also to teach us that there are people, not centuries ago, but today as we speak, there are people, it may be in Egypt, maybe in other parts of Africa, in other parts of the world, they live on the threshold, the minimum amount of food that is required to sustain health, sustain the body. And yet, however, we seem to have one of the problems in the West, and I keep saying the West because I live there and I'm based there, but one of the problems is gluttony, overeating. So not following this hadith of having a third for the food, a third for water, and a third for it. And this causes great disease. Many of the diseases are created from what we eat and overeating. Therefore, we need to look at this very seriously, that the month of Ramadan is not the month of ta'am, it's not the month of food. This is, yes, definitely a part of it, but we need to looking at which foods and which drinks that will nourish us to keep us active. Because again, eating the wrong things will make us very tired, will make us very lethargic, very sleepy. Therefore, we may not even be able to go to work. So let alone trying to conduct our daily activities, what about the night prayer? And one also finds the physiology of the body, after a sustained period of not eating something, when you eat something, maybe some of you experience this because I've experienced this, maybe you become tired as soon as you eat and you broken your fast, and become cold as well. And the reason for this is that the periphery, the blood in the periphery of the body, in the outside of the body, is sucked in, drawn into the stomach, because the stomach is where the digestion occurs. So hence, the blood is taken away from your fingers, your toes, and you become cold. And also the blood is taken away from there, taken away from the brain. Hence one becomes feeling of tiredness, sleepiness. Therefore, it might be a recommended idea after breaking your fast, maybe have some dates and some milk, again according to the sunnah of Nabi Sallallahu Alaihi Wasallam. Then make your prayers, Salatul Maghrib, which is again an exercise. So this exercise will restart sending the blood into the periphery to warm you up again. And not only that, it will send the blood to the brain when you go into sujood, as we mentioned. This sending the blood to the brain will give you alertness again, because you will be feeling tired. And maybe take some rest. I don't think it's any harm in one having a short 5-10 minute nap, because especially if you're going to stay up, depends on each individual's regime. I know in the Middle East, the work starts in the evening time, and maybe in Ramadan this reduces. But for those of us living in the West, because we still have a 9 to 5, 9 to 6 job, apart from maybe those who are doctors or those who obviously need to work at night times, this depends on your schedule, only you will know that. And again, very important for those who have any medical conditions, that they should consult their general medical practitioner, that's their GP or doctor, otherwise known as the physician, who understands the concepts of fasting, because not everyone will be aware of this, especially if we're living in the West. Maybe you go to your doctor, your GP, and he doesn't really understand the concept of fasting. He will understand maybe some of the physiology, but he may not be able to give you that specific advice. So it may be worthwhile visiting a doctor or a physician who understands the specific disease and that can help you so that you can have a sustained and nourished lifestyle in the month of Ramadan, and can benefit you afterwards if you are going to use fasting as a way of detoxifying your body. And as I stated earlier, a lot of disease is caused by the bad things we eat or the amount we eat. Therefore, if somebody has high blood pressure, somebody has diabetes, fasting for certain periods of time for them is very beneficial, even outside the month of Ramadan. Because again, it will provide a detoxification for the body and allow the body to cleanse itself and purify itself in conjunction with other prophetic medicines. As we mentioned, the hijama, very important concept to clean the old blood. If we again look at the concept of the body being an engine, Every year you take it for the service, for the MOT, and you draw out the old blood and all the bad cells or the gunk that is inside it. And this allows the body to refresh, replenish itself. And a lot of chronic diseases are caused by the insufficiency or the quality of the blood being poor. So in the small little cells, we have the veins and the arteries, and from this leads to the capillaries. The very, very small, like tree branches, if you want to call them, where the leaves come off. And if one is diseased, has disease in the blood and the circulatory system, it has been found that 70% of diseases come from this. Therefore, refreshing and replenishing the blood is essential for every human being. Even for the child, over a certain period, a certain age, is very, very important, inshallah. Obviously, fasting is not recommended for certain categories of patients. For example, children under the age of puberty, nursing mothers, pregnant mothers, those who have any chronic or even acute medical condition, and those for travelers. Therefore, it's very essential, as I mentioned earlier, for even a nursing mother, a lactating mother, in this month, if she does want to fast, then she needs to consult a nutritionist, consult her doctor, so that she eats those things that are beneficial not only to herself, but that will create the milk for the child and be beneficial for the child. Again, those who have chronic diseases, diabetes, any degenerative heart conditions, it's very, very important not to miss your medications. There is one case of a gentleman who was epileptic, and he was very well controlled, meaning he was taking his medicines regularly for many years, and he came to 1 month in Ramadan, and he thought, okay, this time I've been fine for all this period of time, I think I will fast now, because he considered himself to be fit and well. So he stopped his medication, and he had a fit whilst driving. Alhamdulillah, he was okay, but when he went to the hospital thought he was becoming non-compliant, not taking his medication. They didn't understand his situation. So the two things arise from this. One is the hospitals in the West, maybe those who work in the hospital environment, can educate their colleagues on these very simple things. And also for those patients, not to miss medications or to take high doses of medications. For example, they fast the whole day, and at the suhoor or breaking the fast, they take all the medications at once. Because again, this can be detrimental to one's health. An example, an elderly lady from the Indian subcontinent, she had high blood pressure, had cardiac heart troubles. So she decided to fast, and she took all the medication at once. And this caused adverse problems for herself. So very, very important for healthcare professionals to educate their colleagues into the understanding of what is fasting and how to maybe tailor the needs of the patients. For example, those who are diabetic, maybe physicians can advise better that they can have longer acting drugs that will benefit them, more control of the diet. And for the patients, again, very, very important concept to consult those who know what they're doing, the physicians and the doctors. And again, for example, dentistry, from what I'm aware of, it's not forbidden for someone to have dental treatment. For example, the anesthesia, it is not giving nourishment to the body, hence it does not break fast. So anyone who requires an acute emergency dental pain, this can be treated without breaking the fast. But obviously, if one is required to take medication after this, or if the only problem that we may find is when they use the water in the mouth, if you swallow this, and this would break the fast. So you may wish to abstain this. I'd like to thank you today for joining us. Wa jazakallahu khairan, wassalamu alaikum wa rahmatullahi wa barakatuh.